So now it falls to me to introduce Paula Jacob, the CEO of the American Foreign Service Protective Association, to speak to the members about what's going on with that organization in terms of health insurance and the other program that's offered. As many of you know, Paula and her husband have come to Florida typically in January to speak to the annual general meeting. So this is the next best thing, and we're looking forward to her remarks. So Paula, are you ready for us?
I am. Good morning, everybody. I hope everybody is well and safe in Florida. We are well and cold in Virginia, but I would much rather be down there. But here we are, and I'm delighted to spend a few minutes with you. Can you hear me, Alan? Anybody?
Yes.
Okay, good.
Yes, we can hear you fine.
Great, great. Okay, so I did send a little overview, and I don't know, did that get distributed, Rebecca?
Yes, it did.
Oh, good. All right. So I'm just going to quickly go over, because I think we have what, about 20 minutes together. Is that right?
That's correct.
Okay. So I'm going to quickly go over some of the information that I provided on my little sheet. And then I would like to open it up for any questions anybody might have about the FEHB program in general and or the Foreign Service Benefit Plan. So I have been asked many times to talk about the impact of COVID on healthcare and of course the FEHB in general. And I think that this is going to be around for a very long time. It's not just the cost of testing, which is on the plans, but it's also the cost of vaccines. And while you may have heard that the government is paying for the vaccine, that is in fact true. They're paying for the ingredient costs, but the plans are paying for the administrative costs right now, the cost of administration. So there will be some costs to the plans. But the main issue that all of us in the healthcare industry is having is really how are we going to pay for the cost of care of COVID? Because as you can imagine, this is going to run into the millions of dollars. And most of us have looked at that and have planned for it, are planning for it way beyond into the future, and not only this year's premium, but also 2022 and beyond. But another thing that we are looking at is the delayed in treatment, This is not like auto insurance, where if you avoid an accident because you're not driving, you have done just that. You've avoided an accident. But the delayed treatment that many of us are seeing will have some effect in our health on down the road. So the plans are looking at how this will turn into more serious conditions or chronic conditions because of the delay in treatment. There are new technologies that are out that have nothing to do with COVID, but we're looking at the cost of the specialty drugs and gene therapy, and also you've heard the new immunotherapies. So these are all things that the FEHB and really the healthcare industry in general is looking at, as all the other plans. But it's important, though, to understand the services that are available to you now. Most of the plans really went all out in the telehealth arena, where you can actually go do a virtual visit with a provider through a vendor. We have had this, the Foreign Service Benefit Plan has had this benefit for many years. We did up it during COVID, as many plans did, at the direction of OPM. It is a wonderful, wonderful mode of treatment. And for those of you who think you might want to use it in the future, I would recommend that you register at whatever health plans vendor you have, so that they have all of your medical information available when you do call. Now, telemedicine is a bit different, and this is the virtual visits with your specific provider or PCP. And many plans received emergency agreement from OPM for 2020 because of COVID. And some of the plans also received approval from OPM to continue that at the normal cost share as a normal benefit for 2021. So that's a really important addition, in addition to the alternative benefits that we're seeing, especially with massage therapy and chiropractic and acupuncture. People are really turning to those. Hearing aids is a big thing that you may not realize your plan has, as far as the ancillary offerings for discounts on classes and things like that. And let's not lose sight of the health coaching options for chronic conditions, even in the arena of in the time of COVID. It's important to take care of our health, no matter how we do it, whether it be virtually, whether it be through home, through health coaching, on the phone, whatever. And all of the plans have gotten really better at the programs they're offering to help you with chronic conditions and wellness programs. Don't let COVID get you off track as far as your own wellness. And the health plans are getting better, have gotten better, and not only the types of rewards that we're offering, but also we're making it easier for you to claim those rewards. And this has been an evolving thing, so the plans are getting better at that. A couple of other things before I turn this over to questions is the HIPAA 3 form. And I think I discussed this last year with you when we were all together at that beautiful venue. If you want your husband, your wife, your children, whomever, to be able to talk to the health plan about your claims even, or your health care, you need to have a HIPAA 3 form filled out and on file with your health plan. Either that or a power of attorney, a medical power of attorney. Otherwise, your health plan, we are all prohibited through HIPAA from discussing your health information with anybody else but you. And regardless of what health plan you have, on my form, I do have our website where the members of the Foreign Service Benefit Plan can fill out the form, but all of the health plans have this form available. And I would suggest that if you want us to be able to talk to a loved one about your condition or your claims, even the status of your claims, that you fill one of these out. And for anybody who is on a maintenance medication that your plan may have required a prior authorization, please understand that these authorizations are on an annual renewal usually. So leave plenty of time to contact your provider to make sure that that keeps in effect and you're not waiting for that authorization to come through when you need your medicine. And lastly, I just want to go over the Medicare. There's not a whole lot of stuff new on Medicare and the FEHB program this year. There has been an increase in premium for the higher income enrollees. No big surprise there. There is an increase in the Part A and Part B deductibles, but that's covered by your FEHB plans, depending on what type of provider you go to. So you're still covered with that. And many of the plans have really upped their game as far as incentives for those who have Part B enrollment. So let's not lose sight of that. Most of your plans will go ahead and waive the co-payments and co-insurance and medical deductibles. For those of you, if you have Part B, some of the plans offer lower prescription co-pays if you have Part B, which is advantageous if you're on a lot of medications. And some of the plans will actually reimburse you for your Part B premiums. Not all of them, but for a maybe $600 or $800 or even $900. It's not a lot, I know, but it may help. So if you have one of those plans, you may want to look into that because it is a benefit that you have. So those are all some of the incentives that you get for having Medicare Part B under the FEHB program. So I know I went fast, but given the limited amount of time that we're together, I did want to leave a lot of time because I find it best when there's interaction, and I am open to any and all questions that you might have for me, and hopefully I'll give you the answers that you're looking for. So with that, I'll turn it over to either Ellen or Rebecca. Anybody have any questions for me? Because I can go on talking all afternoon, but I don't think you want me to do that.
I think that we're still without questions. You guys please, she's on our dime for the moment. So if you do have a question, you can ask it on Q&A, or you can raise a hand. Let's see, I've got one hand raised. Let's see. Joyce, did you raise your hand?
Yes, I did. Can you
Alright.
hear me?
Yes.
Yeah.
Yes. Hi, Joyce.
Hi, Paula. Thank you so much for all that updated information. I just this past year, I've been having some costly over-the-counter medications that, after long conversations with your people, I believe, tell me that I can get the pharmacy discount for these over-the-counter meds. But I needed to jump through some hoops. So I wanted to clarify with you exactly what a member must do to take advantage of this benefit of getting lower cost over-the-counter meds that are going to be long-term.
Well, that's an excellent question, and I'm not quite sure that I can answer it right now, but what I can do is I can check it out and see exactly what you were told and what over-the-counter meds you're talking about and what discounts they're referring to. I know that some of the over-the-counter meds you can get reimbursement for on your health fund for your healthy actions. And I also know that some of the pharmacies do offer their own discounts for over-the-counter meds. But Joyce, if you let me take that back, and I will get back to you on the answer as far as how to obtain those discounts. And then maybe you want to share it with your colleagues.
Yes, I would, because I think a lot of us at this point,
Right.
some of
Yeah.
those meds are
But
quite costly.
I don't want to guess because, you know, I try not to act like I know something when I don't. But let me get back to you with the correct and full answer on that. All
Thank
right?
you, Paula. Yes,
Absolutely.
thanks.
All right, Paula, we have a question from Karen about how do you do Part B reimbursement?
All right. Okay. Hi, Karen. So it depends. Okay, the Part B reimbursement, it depends on what health plan you have. And there's several plans in the federal program that do offer some type of reimbursement for Medicare Part B enrollees. I will tell you right now, the Foreign Service Benefit Plan is not one of those plans. We do not have that benefit, nor are we planning on having that benefit. But there are several plans that do. Blue Cross Blue Shield Basic is one of them. If you have that, there's a lot of HMOs that have that. Aetna Advantage, APWU have that. So it really depends on what health plan you have, including GEHA High has a small reimbursement for Medicare Part B enrollees. And how you do that is you go to their website or you go to their brochure, and it will be in section H of their brochures that will give you instructions on how to file for reimbursement of your Medicare Part B premiums. But it will be, if they have it, it will be under section H in your brochure.
Okay. I believe she has the Foreign Service Benefit Plan, FSBP.
All right, and we do
Karen,
not offer that.
Karen, before I move on to the next question, would you like for me to unmute you? Just no. Okay. All right. The next question is Frank Young has raised his hand. He has a question as well.
Yeah.
Hi, Frank.
Hi, Paula. Actually, it's a kind of a two-part question. The first one builds on Joyce's. A lot of the plans are pushing the mail order, the 90-day mail order. And a lot of the, in my case, I have GEHA. CVS Caremark is nothing short of a disaster.
Oh.
It's about the worst and it gets worse every year. CVS, ironically, is offering better deals over the counter for 90-day prescriptions, but the only difference is you have to go pick them up as opposed to mail order. Do you have any sense of whether or not the health plans are paying attention to this anomaly and whether they're going to try and stop trying to encourage you to do mail order when sometimes A, it's inefficient, and B, you get a cheaper price at the pharmacy. The second part of the question was, I would have thought with people using healthcare a lot less this year because of the pandemic, ironically, that premiums would not have increased so much. And they kind of increased more than I expected.
Okay. All right. So I'm glad you clarified that, because Joyce, when you said over-the-counter meds, I thought you meant just that, non-prescription
I did.
over-the-counter meds.
Exactly, I did.
Oh, you did. Okay. So there's a difference between non-prescription over-the-counter meds and then what Frank is talking about.
But I was asked, just let me say that I was asked by your plan, or maybe it was by the pharmacy when I went in to ask for the discount, that I needed a prescription, even though it was over the counter. So that was one of the steps I had to take, get a prescription from the doctor, even though it was over the counter.
All right. We'll talk further about that offline. I'll get back in touch with you. I promise. And you know I will, right?
Yes, thanks, Paula.
Sure. Okay. So Frank, back to your question on a couple of things. So as far as the 90-day, the supply of maintenance, the maintenance drug supply, many of the reason that all of the plans, including ours, has a pretty robust mail order program is because of the discounts that we are able to get and you are able to get from the manufacturers when you are using the mail order process. All right. Though, and so we're able to take that to you. Now, I can't speak for the other plans, but what I can do is speak for the Foreign Service Benefit Plan. A few years ago, I pushed Express Scripts to get the same discounts for those maintenance drugs at 90 days at what began with Walgreens, so that we were able to put what we call a Smart 90 program in, meaning that you could go to Walgreens and get your maintenance prescriptions, your 90-day supply of medications at that pharmacy, at retail, at the same discounts that you got at mail order. So once we were able to work that out with the manufacturers, I agreed to let our members get their maintenance medication at Walgreens through their 90 days Smart 90 program. I have since been able to extend that because to CVS pharmacies as well. So this plan allows you to get your maintenance drugs for up to your 90-day supply at either Walgreens or CVS and still get the discounts that the mail order will provide. I can't speak to how GHA has their setup with Caremark and with their manufacturers.
Okay.
But the reason that the plans, all of the plans really push the 90-day supply is that we are under tremendous pressure to keep prescription costs down as low as we can. And we are looking at every avenue we can. So if we get the discounts and you get the discounts for mail order, then that's what we'll push.
Okay.
So I hope that explains a little bit about the why.
Okay.
As to how, I can't really talk on what GHA has done with their CVS Caremark. All right, now let me address premiums also, okay? Because your question was about the premium, and I talked a little bit about what the plans are anticipating as far as what our costs are going to be in 21 and 22 and beyond. Healthcare has gone down. We are down, depending on what it is, whether it's inpatient care or doctor's visits or whatever. All of the plans are seeing lower utilization on those face-to-face and outpatient surgeries and inpatient surgeries. That is in fact true. But like I said, this isn't car insurance, and we're not going to avoid this. Just because it didn't happen this year doesn't mean it's not going to happen, or in 2020, doesn't mean it's not going to happen in 2021. And it is our responsibility to make sure that whatever health plan you have, you expect us to anticipate these charges. So we tacked on, when we did the premium as negotiation with OPM, we had to put in what we felt would cover some, but not all, some of the costs that we're going to see this year and next year, not only with the cost of COVID in general, the millions of dollars once those big claims hit, but also the cost of maybe you may have a little flutter in your heart, but you didn't go to the doctor, and now you've got a heart disease or something like that, or you have a problem with the knee and you didn't go, so now you have to have a knee replacement in 21 and 22. So we are anticipating that while healthcare costs may be down, it is not going to stay that way. And while the plans have certain levels of reserves, we also don't want you in 2022 to be hit with a 10% premium increase. So many of the plans, as our plan is looking at what do we think it's going to be in 2022, 2023, 2024. I look five years out and try to develop a premium for each of those years so that you're not hit with a huge rise in premium costs because I didn't plan for enough. And all of us are struggling with that same thing.
Thank you, Paula. That's
Okay,
good.
I hope that helps explain it.
No, it does a lot. Thank you.
Good, thank you.
All right. I know we have a couple more minutes on the program. It doesn't look like we have any additional questions. Everybody, sort of last chance here to ask some live questions to Paula Jakubs of AFSPA. Get that right?
Yep.
Let me see if there's anybody else here. Anybody else want to raise their hand or put something on Q&A? Going once. Going twice. With that, I think, let's see, I'll turn it back to Mike to thank you, and then we will move on.
Okay,
to
well,
our
once
next
again,
panelist.
Paula, thank you so much for taking the time to be in touch with us, even though it's at a distance. And we can all hope that next year you can come in person, bring your husband, and enjoy the relative warmth. If it's any consolation, we're having an extremely cold winter here in Southwest Florida.
Well, thank you very much. I always enjoy being with you guys, and I hope that the document that I sent is helpful. Hi, Ellen. And that please feel free to send me any further questions. You know how to reach me. And Joyce, I promise I'll get back to you on your other question. Okay?
Yes,
you guys stay safe there.
You too. Thanks so much. Bye-bye.
Bye-bye, guys. Have a good meeting.
Okay.